Steve White.
Steve White?
Yeah. I'm the director of the Pacific Clinic. We do mostly around concussions and around head injuries. But it's a protocol that we do using the LiveO2 and the VibraGenix. We call it SSR. It's a super stack recovery protocol. The combination is phenomenal. We use the oxygen contrast therapy to help get the oxygen into the brain. That takes you into like a hypoxia, then floods you with oxygen and keeps doing this back and forth, because hypoxia or CO2 is a vasodilator, and so kind of when you're low on the oxygen level, your capillaries dilate, and then boom, we hit it with oxygen. But we actually put them on the VibraGenix first and kind of get the blood flow and get everything going. It's very, very effective. Then we hit with the contrast therapy, and then we go right back on the VibraGenix with oxygen. And as I always tell everyone, we kind of coast home for about 5-10 minutes on the VibraGenix. So the combination of this and the SSR is really effective. I used it. I had PCS. I had Post Concussion Syndrome, and I was pretty sick this time last year, or actually about a year and a half ago, 2 years ago. So I used it in my rehabilitation. Started a program with some other modalities, but VibraGenix was the main part of us getting to my cells and trying to get the blood flow and getting well. Yeah, at our clinic, you know, I couldn't say 100% of people gotten better, but just watching, we have stats we take and we go through the cognitive. I still have trouble speaking, but a year and a half I was in the bottom like 4%, 6%, something like that. And my last stats, I was at about 78%. Wow. That's just about a year's work. So I always tell everyone there's no magic bullet. You have to work your tail off, but having the right technology and the stuff like VibraGenix and the right technology can make a huge difference when you're working hard at it. Well, I think it's incredible for injuries as well. I think it's pretty amazing. The whole body vibration, you know, obviously gives you more blood flow, and then using the cell exciters seems to, or I guess there's research that non-weight bearing vibration also oxygenates the blood. And so anybody with injuries, it's amazing. And then for me, obviously my passion is people who've had concussions, TBI. I was having like 1 to 2 seizures a month. I haven't had a seizure for 9 months. And VibraGenix was a big part of the protocol that I was on. I have a kind of a 5-pack, if you will, that I use. I use the one for encephalitis, whatever it's called. There's one setting that I use for that, and then I use the mood boost and the energy boost and the stress relief. And there's 5 that I put together that kind of seem to be the most effective. Yeah, you can set it, and I had you know, the experts show me which ones they thought to use, and I've done it for months, so I kind of got to where I could feel it. Especially with I had really bad tinnitus that went with my seizures, and when I didn't have my seizures, and just horrible headaches, and I could really see the difference with the tinnitus. Yeah, for me, the whole protocol I was doing, and it's all centered around the VibraGenix, was yeah, life changer, is life saver for me.